Good morning. Welcome to our monthly Lunch and Learn. This month we have an exciting presenter from Cedar Rapids, and she is going to tell us all about the community-based recovery services that are available to people in our region. Terry is the Director of Community-Based Services for Unity Point Health / Abbe Center for Community Mental Health. She earned her Bachelor of Arts degree in psychology from Co. She's been with the Abbe organization for 14 years, serving in various leadership roles across multiple community-based departments, including home-based and habitation, supported community living, day habilitation, intensive residential services, intensive psychiatric rehabilitation, community support program, and assertive community treatment. Each service specializes in treating adults with severe and persistent mental illness, varying in service delivery environments and frequency of contact. So welcome, Terry. We look forward to your presentation today. If you have questions for Terry, please put them in the question and answer, and we'll try to figure out a good time to ask Terry and get in informal conversations today, because that's definitely part of this. We want people to feel free to interact with us, and welcome again. Thanks, Terry.
All right, thank you for having me, and thank you for the introduction. So I'm here today to talk about a variety of services on a continuum of care that we categorize as community-based services. Again, love any questions or discussion or thoughts that you might have as we walk through this, so feel free to interrupt and jump in when needed. I think the most important thing to start with community-based services is it's a type of service where the individual is voluntarily engaging in these services, and there isn't the control on the side of the provider that perhaps other placements may come with. So these services are truly designed and driven, and goals are established by the person receiving the services. We, of course, certainly try to positively influence what that looks like, but the person really is in the driving seat, and then we get the privilege of coming along for the ride to help guide them in their recovery in the way they'd like that to look. So all these services provide a continuum of mental health treatment. So as they stated, that really is determining frequency and intensity of the service. Each community-based service comes with a specific level of care and qualifications, of course, to receive the service, but also helps determine intensity, frequency, and what that treatment team looks like that's wrapping around the person. Community-based services are committed to helping people with life satisfaction. So just like you and I, we have areas in our lives, including home, work, our relationships, ability to do tasks of daily living, access our community, and manage our emotions. Those are all components of day-to-day life that we help individuals address in their plans and in their services. These community-based services tend to be more cost-effective than inpatient type programs, obviously, like jail, hospital. These programs exist to deter those types of services from happening and or reducing the need for that. So there's some adequate support and wraparound care to not access emergency services as often. So as I go through all these programs, a lot of the questions that come up is they sound exactly the same in some aspects. So I will attempt to point out those differences, but I think the similarities are you're serving the mental health population just in different intensities and frequencies and or environments. So that may be in a home, that may be on the streets, that may be in a shelter, maybe in a habilitation home. There's a variety of environments that these services can take place. And again, it's based on the individual's needs and wants versus maybe perhaps what a professional assesses as the highest need for that person. So again, the control is in on the plate of the person who's receiving the services. We're going to go through every acronym that you can think of in the next couple of slides. So the first one that I want to touch on is one of our more intensive community-based services. So that is the ACT program. We call it the Program for Assertive Community Treatment. We provide this in Cedar Rapids and surrounding areas, including Marion and Hiawatha. This service is a very unique service because it is an outpatient service. So we are going out and finding the individual in the community, whether that again is they could be homeless, they could be in the shelter, or they could be living in their own home or with family or friends, a variety of different environments out in the community. The uniqueness to this program is the services come with an interdisciplinary treatment team. So your services come with a psychiatrist, nurses, master's level clinicians for therapy, comes with a vocational specialist. You have a substance use specialist as well, case manager, and a peer support specialist. So this team is designed to have case managers and then these other special components. And each person on the team is a part of the person's treatment. The person will be assigned a primary person, depending on where their highest interest lies. Then they still have access to the psychiatrist, the therapist, voc, and so on and so forth. So this service requires a lot of collaboration. So this program meets daily to decide who's doing what for each person in the program, whether that's medication visits, phone calls, in-person visits, accessing resources, getting people to appointments. Those are things that are problem solved and discussed amongst the interdisciplinary team daily and assessed daily altogether. Um, some of the requirements for PACT is you are seeing that psychiatrist that's part of the PACT program through Abbe. You're also doing therapy and accessing these other specialists through this Abbe program specifically. But it's designed, this program is really for people who are, it's not a maintenance program. So it's assertive for a reason. It's specifically assertive in its outreach efforts to find people and reach people to engage in recovery. So a lot of the population of PACT clients are maybe struggling with hospital admissions, ER visits, jail, trespassing, medication adherence, psychosis. This program is for people who are very intensely ill and needing some support at all areas to adhere to some treatment and engage in treatment. So a lot of daily monitoring and timely interventions. While the service itself, you go meet with someone face to face, there's a lot of behind the scenes collaboration that team completes as well, like phone calls, talking about jail diversion, interacting with law enforcement, working with natural supports that may be involved in the treatment. So a variety of hands go into the treatment of these individuals. And again, the uniqueness is that interdisciplinary team that is available to the person to meet all of those needs. Another intensive community-based service is habilitation homes. So typically, or once referred to as group homes, habilitation homes focus on acquiring and maintaining skills. The habilitation home is provided to the individual. So about 4 to 5 folks live in a habilitation home, and they can receive services anywhere from 8 to 24 hours a day. So this program is designed to not only provide support and treatment to all of those areas of functioning in one's life, but also provide structured and safe housing to go with it. The individuals in this program, they pay rent or utilities just like you or I would in the community. They have a community landlord that provides the housing and assists with the maintenance and property management. So it's a really good opportunity also to build positive rental history and experience by having someone help you navigate the challenges of housing and build up that rental resume to perhaps one day achieve housing on your own and learn some of those communication and processing skills with how do you maintain your home and communicate with a landlord and ensure things are taken care of. The actual service itself, it can be 24 hours a day, 365 days a week, depending on the level of care. So these homes tend to the hours are staffed based on the needs of the individuals. So levels of care are grouped. For example, there may be a house where each person living in there requires 24/7 minute to minute care, all the way down to individuals that maybe only need 8 or 10 hours of support a day. So very much flexibility in the duration of time that staff may be coming in and out of your home to provide that service. Again, habilitation homes are part of the home and community-based services line. So acquiring and maintaining and building skills is the primary purpose of this service. And again, it can be in any category of life, most often daily living skills, symptom management, medication management, cooking, building relationships, getting out into your community. All of those things can be addressed through this program. Habilitation homes are very popular even outside of Abbe. There lots of providers provide this level of care. We currently have 15 habilitation homes sprinkled through the Iowa City, Cedar Rapids, Marion, and Manchester areas. Moving down to what is usually considered as a less intensive treatment, but can also be a treatment that individuals that are a little skeptical about engaging in services and or maybe are not ready to fully engage in a service that meets all their needs. These are also very good starter programs to get someone engaged in the recovery process. So SCL stands for Supported Community Living, and then the CSP program is the Community Support Program. They're very similar as to why they're sharing a slide today, but I will point out the differences in these programs. But these are very low intensity, low frequency services and can be considered more of a maintenance service. So supported community living is part of the HCBS, so the home and community based service structure, where again, it's acquisition and maintenance of skill in shorter duration. So SCL typically includes someone going out to the home or the shelter, or they may be homeless to work on teaching and acquiring skills and supporting um, in a more in an area in which the client controls. You're looking to develop those independent skills, symptom management, again, very similar to the skill acquisition that occurs in the habilitation home setting. This service can be up to 5 days per week, and visits tend to be about 15 minutes to an hour. But again, there's some flexibilities in meeting the individual needs of that person. So that could look a little different based on the assessment and the treatment plan for each person. Um, those services are sprinkled everywhere. So, Lynn County, Johnson County, and Delaware County, we have a wide net of where SCL can be provided. And again, a one on one service in the community to meet those individual needs. Then, scooting over to community support services in this program. What's great about CSP is there's less emphasis on acquiring and maintaining skill, or at least providing the evidence of, and more of an overarching or encompassing program that meets all factors of life or functionality. So it can be more of a maintenance service, and you can address all the categories, including employment, assistance with daily living, um, applying for benefits, entitlements, housing, things of that nature, in addition to mental health management, medication management, things that are already covered in these previous services, in addition to some outlying supports that can be tackled in this program. Um, this one again can be very minimal. It can be one phone call and a face-to-face intervention a month, all the way up to 4 to 5 contacts a month. So again, CSP can be kind of a high intensity or low intensity based on those contacts. But again, even at high intensity, 4 to 5 contacts being that maximum service. But a great maintenance and engagement tool to get folks invested in their recovery, and participating in some type of support. CSP is the broadest service that we have for locations because it also is in Jones, Benton, Buchanan, and Fayette counties, as well as our 3 traditional counties. So dehabilitation is also referred to as the fun one, or so that's what participants say, and or I feel like it's looked like that from the community. So dehabilitation is a great place for individuals with serious mental illness to gather in a group and learn skills in a social dynamic or group dynamics. So these programs are shorter term, Monday through Friday, and they focus on teaching skills in a structured environment that fosters relationships, appropriate behavior, choices, and getting to have a little bit of fun in doing that. So, day program up in Manchester is a 4 hour program, Monday through Friday. And then Cedar Rapids and Iowa City provide a 2 hour program, 2 to 3 days a week, to really spend time talking about wellness and recovery and different mental health topics. Can be the class of the day, so to speak, or it also encompasses community integration, like going bowling, going to the movie theater, accessing museums, and really experiencing and integrating into the community, with a group of people who are also working through recovery in various ways. So it really emphasizes the importance of natural supports and relationship building and being a part of a community and helping people access and feel a part of that in their own way. So, again, tends to be the fun one, but there is critical thinking and reflection with learning how to manage emotions or work on recovery topics as a group. So, a really great program that is not as intensive. You could attend one day a week up to multiple days a week. And then transportation is also provided to eliminate some of those barriers to connecting with others. A lot of times we can help that person get to this service so there isn't that barrier in access. Moving on to intensive psychiatric rehabilitation, or IPR for short, since that's a mouthful. This service is unique to our Cedar Rapids clinic location. So it's a well established evidence based practice. This service is very much focused on individuals who are ready to make a decision or desire to make a change in their life related to 3 categories. So that could be their living situation, their work, or their education. But there may be certain barriers due to their mental illness that they're not able to work through making that change on their own. So it's a very intensive change management and processing program. It's an individual curriculum that does provide group cohorts to work through making these changes, but it's a very one-on-one intensive way to identify how do we overcome those barriers for you to get that job or to land your ideal living situation or go back to school to get that degree. And it's can be very time intensive to work through the steps in making a decision and having the skills acquired to make that decision and follow through with the change that that person's identifying wanting to make. So, IPR, really, the facilitator is strongly partnering with the individual and helping them be active in the rehabilitation process in making a change in those 3 categories. And I apologize because I see that I left a complete slide off of my PowerPoint. So The last service I want to touch on before we talk about additional services provided at Abbe that may not necessarily be considered community based, but other helpful services that align with the community based continuum. But I accidentally left off intensive residential services, which is one of the newest community based programs in Iowa. So it's only been around for a couple of years, and the birth of intensive residential services came from not having an intensive service that you can fit a square into a circle. So, a lot of higher intensity services like habilitation homes or residential care facilities come with a lot of standard rules and regulations and practices that are necessary part of those services, but not everybody fits into that mold or is an appropriate candidate to be in a residential care facility with 15 to 60 roommates, or perhaps a habilitation home having one staff to five individuals is not intensive enough or frequent enough to help that person maintain stability. So, intensive residential services, also referred to as IRSH for a short acronym, is designed for folks that haven't been successful in any other level of care that's provided on the continuum. And it is the most intensive service outside of a mental health institution or inpatient hospitalization. So, inpatient hospitalization, the next step down is IRSH. And that's because it provides a higher staffing ratio and some interdisciplinary team members. And the service is designed for stability only. So we're not looking for individuals that are coming with skills at all or ability to maintain or manage their mental health or medication. They're allowed to be in the program and be struggling with recovery and those aspects of recovery. So staffing is a 1-to-2 ratio, and the program also comes with an on site supervisor. There's a licensed mental health therapist as part of the program and a nurse or RN. So comes with multiple team members to meet cares individually. And again, this service is for the highest intensity of community-based services outside of an inpatient or locked facility. And we've seen a lot of progress in the last couple of years with why that service is needed for folks that don't fit the molds that I've already walked through. Otherwise, moving on to additional services, I'm not going to walk through each of these individually because I'll be stepping outside of my expertise. But I think it's important to look at, even in community based services, um, there's a reason so many options and layers of care exist, because we all know recovery is not a one size fits all approach. And certain individuals may experience one or many types of services until they find one that resonates with their needs and their goals, as well as what works most effectively for the care and the needs that they're needing. So, um, for example, wanted to talk about with all my acronyms. I'll go back to that slide. Uh, we admitted someone from an inpatient hospitalization setting that had previously participated in other Abbe services and was not successful, resulting in hospitalization. We were able to transition that person to that next step down of intensive residential services in IRSH. And then we were able to successfully stabilize and rehabilitate that person so they could move down to a habilitation home. So started with hospitalization, we're able to achieve stabilization in IRSH, and now we're able to work on skill acquisition in the habilitation home. Similarly, we've had other folks, for example, being in the PACT program. And while the PACT program is intensive outreach and assertive treatment, that still may not be enough without having a structured living environment, for example. So the PACT team has successfully referred several individuals to residential care facilities or habilitation homes to stabilize. And now that person is fully adhering to medications, attending appointments, and able to take care of themselves and build friendships and participate in community activities that they enjoy, where previously they weren't able to enjoy those things due to the severity of symptoms they were experiencing. So, this really is a continuum of care, whether it's community based or incorporates some of those other services that I'm going to hop back to here. But just for knowledge base outside of traditional community-based service, there's a lot of other great services that Abby and other providers offer. So some of those are residential care facilities. Again, not a traditional community-based, but there are skill acquisition habilitation RCFs like Chatham Oaks and Kingston Hill, where there's less beds. So it's not a traditional RCF because they're working on that skill acquisition, just like habilitation homes are doing, but provides some structure and consistency that habilitation homes do not, like having CMAs or LPNs or more nursing presence. It also provides meals, laundry, and maybe taking some of the daily stressors away to focus on mental health. Outpatient clinic services. I'm sure everyone's most familiar with Abby's psychiatry and therapy and traditional outpatient services, which also includes family medicine. But we do have a comprehensive substance use disorder service line. We have, I believe, the first supervisor, Sabrina, presented on the first program specifically during a lunch and learn. So that's an option. We have jail services and diversion. We have nursing clinics, and then we have care coordination and outreach services as well to get people engaged in services. There's also 2 wonderful access centers that are staffed with very committed individuals to address those urgent emergency related concerns that maybe don't rise to emergency room level of care, but really require that crisis stabilization during the heat of those urgent crises or emergencies. The access centers again also come with some withdrawal management and sobering services. So again, comprehensive mental health and substance use services are occurring in those 2 buildings. And then we have some other services on the side, like Club 615 was once also called Club 520. We updated the club address to mosey along with us moving our clinic. There's a 24/7 warm line for folks to call for additional support and connect with a peer. There's the PATH program and then peer support services. So I know we just talked about 40 programs, so that can be overwhelming. But I think again, the important piece is these programs need to exist to have that individual design and care, and how we meet that person where they're at and what they need in their individual recovery. So I'm happy all these service lines exist to reach people in the community. So my last slide is just kind of showing a colorful visual of those continuum of care services and where they may fall on level of intensity and frequency, and is an easy glance to um, decide maybe where someone lands, or a quick glance to see what could be helpful for a person. So as my slideshow concludes, I think the other piece I want to end on is Abby has a centralized intake process for all Abby services that we went over today, especially the community-based services line. So as you're listening and thinking of people you may know that could benefit from services, or you have more questions about services, we have a simple one-page referral that includes these programs. You don't need to fill it out perfectly. You can simply put in, I'm not quite sure, but this is what I know. And a trained specialized intake team member is going to reach out to the referral entity to determine what are the needs of this person, what would be a good starting point or a program that could meet the needs of this person effectively. And that may also include introducing the referral person and the client to an expert individual that works in that program to meet with someone that you might work with, talk about what that service looks like and feels like every day, and determine if it's the right fit for that person. So, by no means at the end of the today do you need to be an expert in all 50 acronyms that we just went over or service lines. It's a comprehensive a list, so there's a whole team dedicated to helping individuals figure out where they land and what will be most helpful, if anything, for them to engage in their recovery and treatment.
Amazing. I didn't know you did all of that. That was very helpful. I think about the times I'm tabling for NAMI and how often people come to me with questions about family members, or they've just moved to town and they're not sure what they should do for their family member or loved one. And so I now your last um, statements really do help me, because I thought, oh boy, I don't know how I could explain all of those. But are there pamphlets or anything that you could share with us that we might be able to share with our community?
Absolutely. So we do have like a 2-page cheat sheet to not overwhelm with the information, but it does talk about what each program is called, how you access it, the main components of the program, what funding or eligibility you might need to be considered, and where the service is located. So I will certainly share that resource with you.
So I was wondering too how you work with AOT, or assisted outpatient treatment, because I know that one of the services that are required in AOT are some of yours, right? Certainly assertive community treatment. So tell us how you do that, because I know that's kind of a separate thing.
Absolutely. So we do have AOT services in Iowa City through Abbe. I am nowhere near an expert, but I'm a big fan of the purpose and mission of AOT because I feel like, again, it's a unique service that meets the person versus trying to put the square into the circle. Um, but yes, absolutely. So I think anytime you can layer or overlap or engage in various programs to meet all of the needs is the best way to go about that, but also being respectful of what the person may or may not want involved. But very similarities to having that multidisciplinary team and just the lengths those programs will go for successful outreach and connection and engagement. Because if you no show your appointment, we in those programs will find you and connect with you anyway, whether you don't meet us at the time or place or agreed upon. We'll continue to find you over and over again to keep you engaged in recovery.
Right. So for those that don't know, assisted outpatient treatment is mandated by court. And so but there are certain things that you need to do in order to get through it. And certainly you offer many of those. Thank you.
Yes. Yes.
I know there might be other questions. I don't see any in the Q&A yet. Tell us more about how you work with peers throughout that system, because peers are really important to NAMI. And so I just wonder how you use peers, and perhaps some of them are people who have gone through the programs. So they're
Yeah.
you know,
Absolutely. So while peer support falls out of my direct supervision, Abby does have a peer support department that is incredibly important. And it went away for a couple of years in some aspects and is now back in full bloom. And we're taking referrals for that program. But speaking for community based services specifically, peer support is an important component of recovery, especially for the individuals in our more intensive programs that may have co occurring concerns such as substance use and mental health. So, we often actually, community based services are the ones that refer our own program individuals to the peer support program, knowing that it's an effective and supportive tool to include in that service. And what's great is in the state of Iowa now, peer support can overlap some of these intensive services where they didn't always let us do that. So you can be in an IRSH home and have a peer support. You can be in the CSP program and have your CSP worker and a peer support specialist supporting you. So our peer supports do great work. I think it's helpful to have someone to connect with lived experience, and also provides a different perspective than what your traditional person in that helping role provides in your life. So we actually are probably the highest referring source in that way, because we really like to get our clients connected to a peer support. And also, it's great to get out into the community with someone that doesn't have a giant binder on your entire history and life and your treatment, and you can really connect on a different level and receive feedback and problem solve in a way that other professionals can't provide that insight. So very valuable service.
True. I met a peer after the walk this year from Abby who works with people with substance abuse.
Yeah. Yep.
And yeah, so that was fun because he gave us his card and he was clearly out there being very being an advocate and yeah.
That's great.
Thank you. I'm trying to think of other questions. All right, one, if money were no object, you had all the money you needed, what other services would you provide? What's missing? Where's the hole?
Oh gosh, just one home. um, oh gosh, where do you even begin without going down a very long hole of disparities and barriers in the mental health care system? I It would be great to, maybe not all the money in the world to make this happen, because I don't think money is necessarily a component, but there's so many hoops to jump through, and barriers and eligibility standards. And then once you are eligible, there's 2 to 3 checkpoints and reviews to make sure that you're still eligible. And those barriers serve as it's a real disservice to individuals, because people give up uh, long before they even get to the service, because it's so hard in this state to get the help, whether that's a shortage of providers, or you don't have the right type of insurance, you don't have disability to pay rent and utilities, or you don't have access to transportation or access to care because you live in a rural environment. There's just so many barriers that I think we could make it easier when someone shows up to a case manager or their appointment or their primary care or their neighbor, their mom or dad, and says, I really would like some help with my mental health. It shouldn't take months of reviews and applications and eligibility, multiple denials, and then waiting for that piece of paper to be authorized. Takes months, and sometimes months is just too long to keep someone engaged in wanting to seek out that help. I just think if there was a perfect world that you could arrive and to this conclusion to say, I would like help with X, and you could get X help timely within 2 weeks, that would be a miracle, because that's the people are face planning it through the cracks of there's just too many rules and regulations to get the help, and we already know there's stigma accessing help. So then when you actually go to get the help, you're told you don't have the right income, you don't have the right insurance, you don't fit in this box or that box. It really deters people from wanting to put themselves out there in the first place. So I would love in a magical world to see people ask for help and get help in a timely manner with less hoops.
Yes, isn't that our goal? Thank you.
Might be somewhat idealistic, but that's why we're all here doing this work. Make
Right.
that better.
Yeah, exactly. Exactly. Definitely more. I hear your comment about more providers. Is that getting better or worse?
I think in some areas it's getting significantly better. Like, I never would have thought that we would be able to have primary care as a whole component to a mental health center clinic, for example. And what a wonderful addition that has been over the years, to have providers that really understand the side of mental health and providing that primary care. Like, that's just a small example of how great it's been to find providers and increase that access to that care. I still am always concerned about community-based services because while the work is really rewarding, it's also challenging. And our communities and society and policies aren't set up to support those programs in the way that they need to be adequately supported to provide quality care and enough of the care to meet all of the needs. Like, there's always a wait list for community-based services because there just isn't enough providers yet to meet the need of the referral base for folks that are asking for help. So I always hope and wish that will continue to grow over time, and that policies and supports will start focusing on community-based approaches as being important and necessary to treatment.
Yeah, that flexibility and passion. Yeah, you've got to have all of those little secret ingredients to do the work you're doing.
Absolutely. Yep.
Thank you so much, Terry. That was a wonderful presentation.
Yes, thank you for having me and taking the time to listen about what Abby's doing in the community.
Well, you've really, yeah, you really opened up my eyes to all the things you're doing. I really appreciate that. I'm sure others do too. Thank you.
Of course.
Next month, join us. We're going to be talking about ambiguous loss. We're going to have someone here, a family member who lost her son, and she's written a book. It's very interesting to hear about that journey. So please join us, and we look forward to seeing all of you again. Tell your friends and family to join us at our Lunch and Learns. And thanks again, Terry. You were very, very good. This was a great presentation.
Thanks.
Thanks.